Do you get this painful clicking in your finger every time you bend it down? Does it get to other fingers too? Or it sometimes lock up and you just can't straighten back out? Try to press down and feel for this tender swelling nodule in the palm when the finger is bent. This is a typical case of trigger finger. And yes, we are here to help. Imagine this is your hand. Within each finger, there are tendons that bend the finger down. In your case, these tendons swell up and become sticky to move. The swollen nodule of the tendon cannot fit through the tight tunnel or pulleys in the hand. Over time, the tendon becomes stuck, causing the painful clicking and locking. You may have pain along the tendon after activities, shooting down the finger or up the wrist. You may also find this curve over your finger joint early in the morning, making it both painful to bend down, but also stiff to straighten. So what causes the tendon to swell? It can be caused from overuse or repetitive grips, but also common if you have diabetes or some of these medical conditions. So what can be done about this? At the early painful stage, you can try using trigger finger splint to prevent painful locking. You also want to avoid any heavy gripping using your hand. This will make the tendon more inflamed and tight. You can help to drain away the swelling around the tendon with regular deep massage. First, try to feel the swollen nodule of the affected finger, then apply firm pressure down along the finger or up towards the wrist in line of the tendon. Combine this with elevation and anti-inflammatory medications to ease the acute swelling. The finger joints can become stiff if you use the splint constantly. Use this finger exercise to both prevent stiffness and help with tendon glide. First, you want to bend down on this knuckle to 90 degrees. Then use the other hand to apply direct pressure on top of the finger at this point. Lastly, use the other thumb to lift up the fingertip here and maintain the stretch. Perform multiple repetitions and aim to maintain each stretch at 20 seconds long. If it's very stiff and sore, try to warm up the hand first with hot towels or do this in the hot shower. If the splinting and exercises did not help after 4 to 6 weeks, consider seeing a specialist for further treatments. The doctor may first consider a cortisone injection into the trigger finger. This helps to reduce the swelling around the tendon and relieve triggering after about a week. The effect may last for several months and the trigger may return. Trigger finger injection is a quick and safe procedure that's easy to recover from. You can return back to work on the following day if your injection did not last long or if you are after a more permanent fix. Trigger finger surgery is also a very safe and effective treatment option. This short procedure takes 5 to 10 minutes to perform under local anesthesia. The surgery involves a small incision over the swollen tendon nodule and divide the tunnel so the nodule can glide freely without catching. The finger can feel stiff after surgery, so best to continue with the stretching exercise mentioned before. I hope you enjoy this video. Please leave comments below.